may consider taking the kids out of the room. I mean, we put Raul in his man cave, so we took our child out of the room. Maybe you should too. I don't know. I think that. What do you think, Dr. Goldstein? Dr. Goldstein from Alvarado Pomerado Hospital, Sexual Health Medicine. You're our sex health expert.
Well, thank you.
And if you guys don't know who Dr. Goldstein is, he's a famous sex health doctor. And you author a couple of journals, and you work with the FDA or against the FDA, however you want to look at it, advocating for women and such. A huge deal. It's good to see you.
Thank you so much for doing this. Happy holidays to you, by the way.
Thank you, and to you too. So there's new information when it comes to something with guys, but you say, and according to you, again, always advocating for women, it's a good thing for women too. Tell us what's going on.
Okay, so about a year ago, the FDA approved yet another drug for men, which is great that they approved drugs for men, but they still have not yet approved a drug for women.
Not one.
Not a single drug. It's very depressing, despite many efforts, but let's not do that on this time. So this is a drug called Xiaflex, Xiaflex, and it's an enzyme. It's an enzyme that digests collagen. So there's this condition called Peyronies disease. That's its official name. It's a condition that affects maybe 5 to 10% of American men. Okay. So when their genitals are aroused, they have a curvature to the genitals. It typically happens from trauma during the sexual activity, typically with the partner on top, and the event, the genital gets bent.
So there's an actual scar tissue.
So then scar tissue forms, preventing it from expanding during the expansion part of arousal. Yeah. So the curvature affects men greatly, emotionally. It's their friend that's injured. I mean, it's a big deal. But it also interferes with positioning, and there's discomfort during the penetration and all that stuff. So
for them or for the woman?
Well, so that's the beauty of this study. Okay. So everything's been focused on the men, the men, the men. And the drug makes the bend less, and it digests the scar. So now the scar stretches more.
Can you use that for scars other places in your body?
Oh boy, you certainly can. So
really?
Yeah, just off the side, there is a condition where you have claw fingers, right? So you can't stretch your fingers out. So you inject the same enzyme in the tendons of the hand, and now you can stretch it.
Oh, you have to inject this drug into the
You inject this. Into the genital, yeah.
Okay, I'm sorry, I didn't realize that.
It's actually not a big deal.
Okay.
In my office today, I have a guy from Saudi Arabia, 2 from Canada, another one from another different country that come because this drug is so fabulous.
You know how to do it.
And I've done hundreds of these things. Okay.
You are famous.
The point is nobody's assessed what happens to the woman while the man is getting treated.
Except you.
Well, so we did.
I love it.
Which is great. I mean, it was about time. So we took men who, in the first study, it's placebo or active drug. So after the men who were on placebo, they knew they were getting active drug. That was the deal. You at some point had to get the active drug.
Yes, right. That's the way studies go,
So in that, we call open label treatment.
Yeah.
We took their female sexual partners, of those who had female sexual partners, who then agreed, and we gave them bother scales, and we gave them function scores prior to the treatment and at various times following the treatment.
What did you find?
This is the coolest study. I love this study. I think it's a very important study of what sex is, because now we're treating the men, but now we're assessing what happens to the women. So let's go to the bother scale. In the bother scale, boy-girl differences. When the men were asked, when you look at your aroused genital, how bothered are you? Extremely bothered, severely bothered, moderately bothered, mildly bothered. What do you think the men felt about?
Oh, they were probably out of their minds.
Devastated, huge bother. What do you think the women scored?
Couldn't care less.
They couldn't care less.
Right.
It was totally amazing. It was so different.
Yeah.
That was not the important.
Okay.
They scored the same on discomfort with positioning and awkwardness during positioning.
Okay.
Okay. Then it came to the function. I think that's the coolest part, because this is physiologic function. This is lubrication issues, this is desire issues, this is the climax issues, this is satisfaction issues, this is pain issues.
Oh.
And it's only the woman. But the woman's not getting the treatment. Okay?
Okay.
So women prior to the study scored poorly. 3 out of 4 women had scores that were consistent with the sexual dysfunction. At the end of the study, so what do you think happened? Because we didn't treat the women.
I don't know.
So the women, only 1/3 of the women had abnormal scores. 2/3 of the women went from abnormal scores to normal scores without ever treating the women directly.
So you never treated the woman, yet functionally she's now...
They had dramatic improvement.
2/3 improvement.
Much less pain, much more satisfaction during the event, much more lubrication, blah, blah, blah. I mean, the only thing that really didn't change was desire, but the whole score was hugely improved. So the message here is that unlike many other conditions, when you affect the function of one partner, you truly affect the function of another partner, and when you correct the function of the other partner, you truly correct the other function. And it's a fabulous message about what we do for a living.
Yeah, I think it's like people like you that make the world go around, just spreading goodwill and happiness to everyone, and it doesn't surprise me that people come from all around the world to see you. You've got a lot of good information, and a lot of doctors, a lot of people just don't have access to the care that you give. You're so specialized in this type of thing.
Well, we appreciate it. We love the fact that you expose San Diegans to information about this fabulous field. Sexual medicine is really great.
Okay, Raul can come out of his man cave now. To get in touch with Dr. Goldstein at San Diego Sexual Medicine at Alvarado Hospital, just visit our website, fox5sandiego.com, and click on the Scene On tab. Thank you, sir, for being here.
Thank you so much. Happy holidays again.
Oh, thank you. You too. Erica, we're going to send it back over to you.